Good morning, everyone. Last time I spoke at a conference like this, we were set a challenge to see how many food puns we could get in to enliven the morning. Being a bean counter, that's going to be quite difficult for me. I also don't have any motorbike analogies either. So I apologise for the dry content, but hopefully you'll be able to understand where government is going with food procurement and what types of issues you might need to be considering in the next few months. So basically, I'm going to talk to you about two reports. As Cilla Black might say, I'm going to give you a quick reminder on the first report, which was back in 2006, which was called Smarter Food Procurement. Why were MPs interested in this whole area? Well, £2 billion worth of expenditure of government money is pretty large, and so it was something that they were considering might not or might be giving value for money. There were also, at that time, quite a lot of food scares, if you remember, so there was some concerns about safety and quality. 85% of that £2 billion is really spent within the four sectors. At that time, MOD was serving about 110 million meals a year, the NHS 300 million meals, and schools 610 million meals. The other big sector that works in public food procurement would of course be prisons, and they were subject to a separate report during the same parliamentary session. So, what are the complications? Yeah, we spend a lot of money, but what are the problems around that? Well, if you look at a small primary school, they may only spend £10,000 a year on their food. So, is that a viable service? Also, although average uptake across the school sector is about 45%, it could be as low as 26% in some areas. So again, how does that affect viability? The thing that the audit officer are always interested in, who's in control, who's accountable? Well, that wasn't that clear at that time. You'd got DEFRA and Dominic and his team responsible for their area of public sector food procurement initiative. You had the former Office of Government Commerce. They're the procurement gurus, also interested in helping small and medium-sized enterprises enter into the government procurement world. You've got the Department of Health, who were nominally responsible for food standards. So it's a bit of a confused picture. And finally, as Peter mentioned, you've got growing outsourcing and complexity in your food delivery chain. MOD at that time outsourced over £100 million worth of business, and they were developing their pay-as-you-dine system. We've got a small number of major players in the area of government food provision, with a small number of wholesalers. But under that, you've got a myriad of smaller second-tier suppliers. So it does mean that there's complexity there. So MPs wanted to know, is this efficient and is it effective? And by efficient here, we are talking about the concept of whole life cost and quality. We're not just talking lowest price. So the findings, they largely came from a survey that was across the three sectors that I mentioned. And to be fair, we found that lowest prices were often achieved by public sector food procurers. However, there was an amazing disparity. I can give you a couple of examples. An 800-gram loaf of wholemeal bread. In some places, people could pay as low as 32 pence. However, in other survey organisations, they were paying £1.10. Pint of milk, 17p versus 44p. Now, we do understand that when you have a contract, it's often a basket of goods, and so some things will be more competitively priced and others not so. But there is area to work on to try and reduce the spread to a more tight range. We also found that just over half of the public sector bodies that we surveyed didn't do any joint purchasing activity at all, even though 44% of schools and hospitals used two or more of the same providers. We found a lack of commercial skills and knowledge about specialist food and catering market. That lack of commercial skills is one of the big questions throughout government. It doesn't just exist in this procurement sector. We found a fifth of schools were struggling with facilities that were more than 30 years old, and I know that there has been significant efforts to try and raise that, but at the time it was of concern. A quarter of local authorities stated that they didn't think they had sufficient numbers of cooks who had the skills to use fresh ingredients in preparing meals. Now, of course, since then we've had Jamie Oliver, so maybe things are changing. There was a lack of focus on environmental impacts and reducing costs in that way. People weren't necessarily passing on utility costs to contracted out services. Schools, hospitals were still picking up the electricity bills, for example. And there was also limited recycling of packaging. We found a general confusion about what sustainability actually meant in this world. And finally, that an awful lot of outdated management information was being used to try and predict what people wanted to eat and what meals should be served. So we arrived on a conclusion that there was a big amount of efficiency savings to be made. Two areas that I'm going to mention in particular were reduced ingredient prices, were calculated to be worth about 40 million over 3 years, and increased purchasing power by people collaborating and joining together, that was estimated to be around 80 million. So what did we actually recommend at that time? Fairly simple. They're all along the same theme. It's about working together more effectively with your suppliers and your providers so that you can get a more efficient and effective delivery of food. At this time, of course, efficiency savings were often sold on the benefit that people would be able to reinvest in their services, raising either quality of food standards or the quality of the service that was provided. Now, you'll all be aware that the rules have changed somewhat, so we'll move on to the most recent report that we did. So again, why did we do it? Well, the theory is that lower prices should always result, either from economies of scale or from using pricing information so that you can challenge suppliers and make sure that you get the best deal. So that's the premise of collaboration. There's also an added bonus that if by collaborating there should be fewer tendering exercises, so leading to lower administrative costs. And again, when we started this piece of work, the idea would be that staff could be refocused to another part of the business that needed some more added value, or where they could manage the contracts and the specialised purchases for their own particular organisation. At this time, the OGC started to put out some very interesting spend data. It had calculated that over £220 billion a year was spent on public procurement. And so that's 1/3 of all public sector spending. Now, in our particular world, central government is where the National Audit Office has its remit. At that time, there was the Audit Commission who looked at local government. The split is 30% central government spend, 70% local government spend. So at this point, we thought, okay, not much point looking solely at central government. We need to widen the picture, because unless we look at the whole public sector, we're not going to be able to deliver the kinds of benefits that we want to. So we joined together and we surveyed 80 central government organisations, 48 local government and 51 National Health Service trusts. We looked at the 8 standard procurement categories under the OGC's programme, so of which food was one of them. And then we issued a report, which you can see on the slide, which looked at the findings and tried to describe the kind of framework and landscape that was operating in public sector procurement at the time. So, the next few slides are going to be solely about food procurement. You won't find them on the web. They weren't released in the actual report. This was all just background data, but I thought it might be useful for you to get a flavour of what we found.